In this video, we're going to demonstrate how the StimTech Neo system works. This is a portable unit that offers interferential, TENS, EMS, and microcurrent in the comfort of your own home. The StimTech unit comes in a easy, small carry case. When you open it, inside you will find the unit itself. You will find two separate cords. Each would be considered one channel. So this cord is one channel, and on the channel it has two electrodes, black and red, and then a second channel that offers the same. So it offers two channels and 4 electrodes total. You also have your sticky electrode pads. These are reusable and can be replaced inexpensively over time. We're now going to show you how you put the unit together. You're going to take one channel cord and insert it into the device, and then you're going to turn it to lock it in place. Then you'll put the second channel in and lock it as well. The next thing you're going to do is attach the electrodes to the cords. And it doesn't really matter which ones you connect them to at this point. We're now going to show you how to turn the device on and use it. The unit does come with a very handy user guide booklet that will show you everything that we are talking about in this video, but it also outlines what all of the buttons mean. And then there are pages that have pictures of different conditions, so neck pain and torticollis, and how you would set up the electrodes. The booklet also describes the different treatment capabilities of the unit and outlines exactly what it is. So here is a description for the TENS treatment, the EMS treatment, the microcurrent treatment, and the IFT or IFC, which is interferential current feature or treatment. We're now going to show you how to turn the device on and some of the features. So at the very top, you'll see a power button, which you'll hold until the unit turns on. It will be a bright green, and then the light will turn off, but if you want to turn it back on, you can press the light button. At the very top, you can see IFT, and that's the interferential current setting. But if you want to change it, you're going to hold the program key for a few seconds, and if you're looking at the top, you'll see that it switches to TENS. If we hold it again, we're switching it to EMS. If you hold it again, microcurrent. If you hold it again, IFT. Let's go through an example of a program. We can select from a long list of different programs depending on what your needs and goals are. So remember, the programs are outlined in the manual, and it's the preset programs that you probably want to look at first. And so here you can see that we've selected TENS. You can see TENS at the top. It is set right now on P, which stands for Program 1 Preset. So this is a preset program for treating a chronic condition. You can see chronic is listed there. If I wanted to change the program, I can go through the different programs by pressing the PROG button at the bottom. You can see in this case, the presets are 80 Hertz, which is the frequency, and 150 for the pulse width. And it's set for 30 minutes. You can also see at the bottom where it says channel 1 and channel 2, and it's showing a 0 right now. And actually you can also see your battery life there. And then these buttons here are where you're going to be able to increase or decrease the intensity of the unit by channel. So you can control each channel separately. So using that TENS preset that I described previously, we're going to show you how we would set this up. What you can do is use all 4 electrodes, or you can use only 2 depending on the area that you're treating. We're going to show you an example of using all 4. So if we look at this patient's arm, we've placed an X on the area that is in theoretical pain or injured, and we're going to carefully take these sticky electrodes off the backing, the protective backing. You'll want to make sure that the area that you're placing the pads on is clean and dry in order to prolong the use of the electrodes, but also get the maximum benefit out of the machine. So using the first channel, which is being placed, the 2 electrodes are being placed on now, what you can see is that we're not putting them necessarily on the painful area, but around it. And we have placed a black one here from channel 1 and a red one here from channel 1. Now using channel 2, if we're using all 4, what's important to know is that with one channel, so if we follow this one channel, with one channel here, it's important to know that the current is going to be traveling from one electrode to the other electrode on the same channel. So in this case, this one from channel 1 here, black, is going to be communicating with this channel 1, red. Similarly, on the second channel, we're going to have this black one here communicating with this red one here on the same channel. And this is important to know so that you're actually going to be treating the appropriate area. And so when we do turn up the machine, we're going to get current traveling like this and current traveling like this. And that's treating this whole area here. And that's why it's important to set it up in the way that I described. Now we're going to show you how you would turn the machine on in terms of intensity. So we have the preset, and we're going to begin increasing the numbers. It's a bright light, but you can see that it's increasing on both sides. And at this point, you should be feeling the intensity underneath the electrodes. And for this, you'll want to turn it up to the point where you're feeling pain, but it's a tolerable type of pain. Sometimes you'll feel that your fingers will contract in the case of placing them on your forearm, and that's normal. Sometimes you can get a little bit of numbness or tingling, which is also normal, even movement at the forearm, but you want it at an intensity that hurts but is tolerable. You will find that you start to adjust to the sensation after a short period of time, at which time you can continue to increase the intensity if that suits you best. If you want to stop the unit before the allotted time, you will need to turn down the intensity first using the arrows on the pad. Note that you likely have to press each channel down individually, not at the same time. You don't want to push both at the same time. And once the intensity is back to 0, then you should be able to turn off the machine and remove the sticky pads. Carefully remove the sticky pads and place them on the protective covers. And remember, clean, dry skin that is free of, as much as possible, free of hair is ideal for best connection, and free of dead skin cells. In order to prolong the life of the unit, it's now going to be important to remove the cords, and you should pull them off, not bend them off or jiggle them off, just a gentle pull. And then similarly, when you take the cords out of the machine, you're going to unlock them and pull out, not jiggle. The last thing I wanted to mention is that if you are only wanting to treat a small area, let's say your forearm, the back and front of your forearm, and you only need 2 electrodes, make sure that you're only using 1 channel and controlling it appropriately on the machine. As mentioned earlier, the booklet contains a number of different images and descriptions of common injuries and shows you how you should place the electrodes. So what you can see here, for example, with neck pain, it was set up on this person's neck similar to how we set it up today in this video on the patient's arm. But what you want to follow here again is that crisscross pattern of the channels. You can see that the number 1 and 2 indicates the channel, and the letter black and red represents each electrode on that same channel that you can see are crossed in order to treat the area appropriately. In this example here, you can see that only 2 electrodes are used in this patient. However, they come from the same channel.